Hi there! Before we get started, a friendly reminder. The information discussed on this podcast is for entertainment and informational purposes only. While our guests are knowledgeable in their respective fields, your personal situation may require unique guidance. We encourage you to consult with a qualified professional for personalized advice. Now enjoy the episode. Hi, everybody, and welcome to another episode of AndWon Should Know, where we journey together to find tips and tricks for taking better care of you.
Absolutely. And I have to say this, I dealt with this massive shoulder pain for so long, thinking it was because, I threw a muscle somewhere when I was doing kettlebell training. But then I realized that it was actually a frozen shoulder. So I took myself to the doctor, obviously, to get some scans and everything. And what they recommended was an injection in the shoulder, which I declined after because I figured, I have to get this sorted somehow with therapy rather than to inject, I think, steroids into the shoulder.
And we're really excited to welcome Dr. Will from Dr. Neck Pain. I freaking love this name.
I do too, exactly. I must say.
Who is a chiropractor that I met just recently through my husband, who's actually seeing him now. Without further ado, let me have Dr. Will introduce himself. Dr. Will, welcome to the podcast.
Hi, yes, I'm chiropractor Will Kala. So I've been in Singapore since 2006, and that's true. I started treating a husband 2 months ago.
Yes.
So why I started with the name Dr. Neck Pain is because a lot of people search for this problem, and during COVID, people started working from home, and they really screwed up their neck, so they kind of became rampant. And so I had to just start over the clinic in that time frame because of COVID. So I thought, okay, Dr. Neck Pain, that'd be the best name, because that's literally all I do. Neck and shoulder problems, how they link together, and that's what I'm dealing with all day long.
Right. Dr. Will, when people say, neck pain, when they refer to someone and say neck pain, it really means it's a pain in the ass.
Yes.
But really, truth is, if you do have a pain anywhere in your body, it is a pain in the ass.
It is.
Yes.
Right?
Yeah.
It's like, wow, there's nothing you can do. It just debilitates you. You can't sleep, you can't go to work, you can't do
definitely.
nothing.
Yeah, it's true.
Yeah. So please tell us why I could have had this frozen shoulder.
Well, you were mentioning this perimenopause thing. So basically, there's a certain link is that when estrogen levels start going down, when you're hitting your menopause and all those years, you actually start having less fluid in your joints. So the joint fluid levels start decreasing, your collagen starts getting a little bit stiffer. So these are all the contributing factors. There's not like definitive proof that this is the reason why, but those seems to be the contributing factor. We get a little bit stiffer when we get older. So those are probably the reasons why we're kind of tipping over the edge.
Right.
So what you could be doing, maybe start using foam rollings, loosening up the area. Corticosteroids, what they're trying to do is to reduce the inflammation and the pain levels. They're effective in that, but they're not addressing the musculoskeletal issue.
Right.
They're trying to reduce the inflammation. I mean, you could do some, dietary issues for that, but if you can be physically active, going for massages. I had a similar issue for my shoulder, and I tried to go for the massage. They sometimes use the elbow into my shoulder blade. Using tennis ball for like acupressure points and things like that. Those are very good things you can do. And of course, keeping active.
Right. But you see, we want instant relief.
Yes. But, when women are getting to that perimenopause, it's a gradual change. So you've been used and the body's been running one way for many, many years, for a couple of decades, and suddenly something changes.
Right.
So the normal activities that you've been doing and your normal diet, as we get older, the system just can't cope with that, and we need to adjust to that.
So would you say
we're more prone to issues then? Yeah.
So would you say that actually having, an exercise routine prior to actually hitting peri will actually prep women a little bit better when they get to their perimenopausal stages?
I think there seems to be a lot of research lately coming up that resistance training as we get our senior years to build up that muscle, muscle structure that we're having because we start losing when we get older.
Right.
Bone densities, all these things to kind of build that up, that buffer, because as we're getting older, everybody's going to have the same issues. We're just slowing down the slope by being exercising.
Right.
So if we could kind of, your CPF savings.
Yeah, it's like insurance.
You accumulate and save that up before you hit that, because if you start like at the bottom, you're going to crash very quickly. But if you build up your buffer, you're going to be dealing with that a lot easier.
That's true.
So if someone came to you and said, I'm having the shoulder pain, it's been there for about 3-4 months, what sort of treatment should they undertake?
Well, For all my cases, I do a couple of x-rays to see how it's linked, because we do have some muscle from the shoulder blade that attaches to the neck. So they're very much linked. So if you have a neck problem, you usually have a shoulder problem, and vice versa. So they're very interconnected in that sense. So I resolve the structural problems in the neck, and that can reduce the stress and tension in the neck and shoulder muscles itself. So then you want to be digging around how's your shoulder mobility, how's your stability, your mobility, stability, how the muscles are activated to support the shoulder joint. So there are some simple rehab exercises that I can teach to individual clients for doing that. And then, of course, you can like use a tennis ball. I have a lot of business people when they're traveling, or they screw up their neck or the lower back in the flights. So they start carrying tennis balls in the carry-on luggage. So then they can just go to the hotel room and lie on it and put something on the shoulder blades to do some acupressure push so they can get some kind of mobility.
That's totally what I do. I carry a lacrosse ball because I find the tennis balls sometimes they get a little bit too soft, so the lacrosse balls are a little firmer, and then
but
they
when you're in like acute pain, if I give them the lacrosse ball, they really don't want it.
Yeah, I'm sure that's
so,
true.
you know, they ease it off. A firm tennis ball works great.
Right.
Right.
Putting off these pains, is that a good way to just, ignoring it?
You got a difference between hurt and harm, okay? We sometimes do treatment, it may hurt you, but it's not going to harm you. So some things you can maybe get away with, all right? But most often, if you have a persistent reoccurring issue, you need to investigate why is this happening.
Yep.
Okay. I mean, for females, there could be other problems like giving the referred pain into the shoulders that could be really severely bad for you. And, you know, that's for the medical doctors to evaluate and rule those things out. But yeah, if you're having like bad shoulder joints or tendon, you can have a partial tendon tear. So it's good to have that. I have seen some clients where the supraspinal tendon is 50% torn off. So they have this chronic ache going on for a couple of years. And then they eventually had to do that with surgery. So at least find out what's going on. If it's just a muscle imbalance that, okay, I need to do rehab exercises, stretching or foam rolling or whatever, that's fine. But if you have something severe, okay, go and investigate. What might be the cause of it? If it's a muscle imbalance, we can work with it.
Right.
And is that tied to, it's, you know, when you see pains within shoulders and necks, is that often also tied to the spine?
We know that neck issues can actually transfer the stress to the lower back. So by fixing the neck itself, there are some studies to show that we can actually relieve issues, lower back pains and things like that. And also getting back to this, if you have a problem and it keeps getting worse, like some people may have strength loss in their arms or pain down the arm. So those are things that can get worse and worse over time. So it's better to rule those things out.
How long did you experience the pain for?
Months. I think about 6 to 8 months.
Oh my goodness.
And I thought by not using it, by just not using it and try to use it less, that then it would get better. But I think that was counterintuitive,
that's probably
right?
the worst thing you could have done. And some people go like really bad and the normal cycle for actually this to resolve itself is about 18 months. That's the normal thing, but discs atrophy, and if you don't mobilize the joint and get the collagen fibers. So like in the 90s, when they started looking more at active rehab. So if you're having issues, you start mobilizing, get the fibers to move in certain directions, get as much mobility, and probably push you through some discomfort level.
Right.
All right. Try to push the boundaries a little bit, because if you don't, you can get the capsule joint to be completely encapsulated. Okay,
Right.
and then you're like stuck like this. So yeah.
Yes, and I was told, because I went through therapy with this, and they say, it's just a mindset. Because if you think about it, that pain when you move is about a second or two. So if you can just get through that 1-2 seconds of pain and move the arm like you said, get mobility in there, it's a mindset change rather than go, no, I'm not going to move it because it hurts.
Just one point there. Just a bit of a human physiology. We got different nerve fibers. So pain, like let's say if you ever hammered a nail and you hit your thumb.
Yeah.
Okay, it's throbbing and painful. It takes about a second for that C fiber to transmit that pain to the brain. But if you start blowing at it or shaking it, the body prioritizes joint mobility. That's the most important information we need for the body, and it overrides all the pain fibers. You'll still have some ache, but the perceived pain level will be less. So that's why we keep shaking the thumb, because we hit it or we keep blowing it, and we don't feel the pain at that moment. So if you can start mobilizing the joints, people with arthritis, whether it's hips or knees, if you can start getting them moving,
Right.
or they put something there wrapped because they can feel the sensation from the skin,
Right.
that will diminish the perceived pain levels for you. So that's why not using it, you're just getting more and more ache.
Yes. And the scar tissue then start to form around the joint.
Yes.
And is there no turning back after that?
Well, that's why we're trying to go mobilizing it, adjusting, manipulating the joints and things like that. Yes, but that is true. If you immobilize a joint, you'll start having these sugary things like a paste. So actually, that's how I did my thesis paper on, is what happens in a joint if you don't use it at all. And you start having something called the collagen crosslinks.
Okay.
So if a scar tissue, it just puts the fibers randomly everywhere. But if you keep moving it, the fibers will align itself. So that's what happens with the joint, because we keep remodeling our body and tissue all the time. So yeah, it would be better if you can move it through the discomfort. Just rule out there's nothing nasty or really harmful going on, no tendon tears or something if you had a fall or whatever, and keep mobilizing, get active rehab, keep moving in and pushing the boundaries.
So what about if someone just comes to see a chiropractor for prevention? Because I know I've been doing that myself because I'm pretty active, and you know, sometimes I feel like I'm misaligned, and then I'll just go see a chiropractor to get an adjustment and then be on my way and then do that on a periodic basis. Is that something that is going to help me for eventually perimenopause, or?
If it helps you to stay active. I mean, I worked like that when I was back in Sweden for 10 years. You know, people come, you know, ad hoc just to get adjusted. But like if modern society now with bad posture, smartphones and tablets, this has skyrocketed. So if you have an underlying postural issue or with the alignment issue with the spine, you want to be getting that sorted out. But yeah, if it helps you to stay physically active, go to your chiro a couple times a year, that's great.
Okay.
Yes.
Is there like a, because I've been doing it kind of once every 6 to 8 weeks. Is that kind of a?
Yeah, that's fine, just to keep yourself. Like for me, I lift a fair bit of weight, so I probably go for a massage maybe 2 to 3 times a month.
Oh, so you recommend a massage before the chiro?
I don't really have any preference when you're doing that, but you know, tissue work. I mean, I probably could be slightly better with foam rolling and stretching myself. But I enjoy going for a massage. Okay, so if they can do a nice massage for me, and sometimes I go there after I've been lifting heavy, just to get the most important is to get the tissue to be active. The worst thing you can probably do is just working the same position all the time, not stretching, not being physically active and all that. So like we talked about, build up that reserve bank for your tissue mobility, the muscle strength and all that.
And what sort of massage? Say if you're doing lifting, because now in my menopausal years, I'm always told, okay, you got to do resistance training. That's something you have to get into your workout schedule. So what sort of massage after the resistance training?
I may go the same day or may go, you know, a couple days later, but I try to get it into a routine. I like the Swedish style massage. I don't like when they go crazy and pressing you that you get this
deep
inflammation.
Tissue,
I don't need that. But if you go regularly, your body, soft tissue, you know, will be getting it. I had a massage course 93, 94, and basically I went there and I got massaged 2.5 hours a day, and then I spent 2.5 hours a day massaging other people. And you know, that amount of massage, you feel like a king. I mean, I was still young, you know, but the body, you're so supple, you're so loose, you feel great. Okay, I mean, that's a bit excessive. People don't have them, but that was part of the course for a couple of months that I had. So I like a firm massage. I don't like this, you know, just gliding over. All right. I later on started doing this without any oil, and they have like the sheet or tissue on top of it, and they have a pretty firm pressure. Also, I mean, I can lift quite heavy weights, over a few hundred kilos for that lift. So they sometimes actually walk on my back to loosen up and walk on my hamstrings. So I don't think the massage should be painful. You should have a reasonable level of comfort, and you don't want to have an inflammation reaction afterwards. So I know some of the Chinese massages, they're very deep tissue, and you're like, oh, I'm sore for 2-3 days later. You should be, you should feel good. Okay, it should be more relaxing and let the frequencies get that better.
Okay, that makes a lot of sense. You know, just a good segue. I'm just curious how you actually got into, let's dial this back a little bit. How did you get into chiropractic care? Like, what made you think, I want to be a chiropractor?
Wow, that's a good question. I think my family being influenced from my childhood. My dad used to go to a chiropractor, but probably the biggest thing that influenced was my sister. They thought she had a brain tumor. My sister, a couple years older, 3 years older than me. So she would have been maybe 8 to 10 years old. I remember I used to search because she had this massive splitting migraines and headaches quite often. So I would fold papers and then cut this corner and then unfold it like a spider web, and I would flash it to her, and she'll get this. I'm a stupid boy. She will get this massive headache attacks and all that, and then Dad will.
It just looked funny.
Yeah, for me. And then I knew if I scraped my knife on the plate, she would, get this. So you get this weird reaction from your big sister, But Dad knew it was, got pissed off, and I got my fair share from that. But she got so bad eventually, they actually hospitalized her, and they thought she had a brain tumor. So she was hospitalized for 2-3 months in Stockholm, Sweden, and they did an MRI scan. That's when it came out in the late 80s. Wow. Doing that. And so eventually my dad took her to see her own chiro, and 2-3 sessions later she had no symptoms. So what the chiro said, she had some kind of a blockage in the neck, and that was affecting the blood flow. So that's the explanation that I remember as a child, and that probably influenced me. And then my dad, blue collar worker, had back pain very often. So he would go to see his chiro, maybe once a month or once every few months. Amazing. To get it adjusted. So that's probably, my dad didn't want me to do the same job as he did. So he actually paid me to go chiropractic school. So since I had some interest of that already.
Yes. So that was the catalyst. That's a really cool, I think
the ethos behind this is great.
The ethos is really great.
Yeah. And when you're 6-7 years old, you're just teasing your sister, but you don't really understand the importance or severity of the whole issue. But everybody was so relieved when she was, fixed by this. It was kind of a miraculous thing. And the chiropractor was the hero in the family,
I used to think that chiropractic care was only for adults, but I've just recently started to also unravel that it's something that children need as well.
Yes, teenagers, they can have, and also now with the tablet use, this bad posture that they have. So there are teenagers that already have a screwed up neck, even with degenerative changes. So the degenerative changes in your neck, the disc and all that, the bone spurs, that's something we should be seeing in adults. It's called age-related issues. So when you're hitting 40s, 50s, 60s, 70s, it should be getting more and more prevalent. I think kids, 14-year-old girls with bone spurs, because they have like a swan neck when the neck is bent completely the wrong way.
A swan neck.
Yes.
That's crazy.
Wow, this is good for our mummies who are tuning in today, because just to look out for your kids.
Yeah.
Because at 14, you're saying you're seeing kids with bone spurs.
Yes, and that's something I didn't think, based on all the medical training that I had, that shouldn't be happening.
Yeah.
Okay, so that was something you will see. Okay, 30 at the earliest, very prevalent in their 60s. So when I had this 14-year-old girl that came in from Malaysia, and her neck was bent like completely reversed, and that's from smartphone use and all that. Another case, a 16-year-old boy from Indonesia, and he has gone so bad that they actually fully fused. Wow. I have not seen a person under below 50 with fused segments.
And he was only 16.
16 years old. So can you imagine when he's in his 20s, 30s, the amount of problems that he will have?
And the pain he must be going through if all the bones are fused.
Well, he had 3 segments in the neck fused already. So what they probably will have to do eventually is to cut that open and put like a metal cage, because it's going to start wearing out the spinal cord.
Wow.
I think you brought some images, didn't you, Dr. Wills?
Yes, I did.
So that we could probably show the audience what it looks like, or viewers
so
what it looks like
I'll just
to have a fused
show
neck.
you first about it. Yeah. So having a straight neck, this is a female lady with that X-ray taken 2011 of her, and we can see that the segments look fairly normal. These are normal segments, like a square Lego block. All right, then these start having some degenerative changes. The shape starts changing a little bit. This should be a nice smooth curvature over here. Okay, and this is her 10, 11 years later. You can see this big bone spur. The disc has gone almost like a flat tire. It's diminished in height.
Yes.
And they start having a lot of severe symptoms because of that. So, yes, like you said, if I have a problem, should I go check it out? Go check out and see if the structure is okay and everything is okay, there's nothing harmful, you're good. Then you can just do rehab work and all that. But if you have a structural problem like that, don't wait 10 years, because these degenerative changes will come.
Yeah.
And I can send you the image of this 14-year-old girl to show what had happened. So she had this kind of bone spurs there. And I have another X-ray of a lady, 86 years old, and she had a perfect neck her entire life. And she has less degeneration than the 14-year-old girl.
Wow.
Yes. So it's important to have the structure. It's like if you're like knock knee your whole entire life,
Yep.
you want to fix that because otherwise you're going to have knee problems later on.
Exactly.
Yeah.
no,
Because
it's
this
true.
is something a lot of women my age are also complaining about. Besides the frozen shoulder, migraine headaches. They're getting lots of headaches.
Yeah.
And we're saying, oh no, it's the hormones and all that. But it might just be something to do with the neck.
Yep.
Definitely. So once you have the degenerative changes, has stiffness and have a structural problem, like this lady here, 58 years old. Okay, she was actually sedated in Middle East because the neck is bent the wrong way. You can see the bone spurs over here.
Oh my.
All right, you can have a look at it yourself.
So,
So-
the neck is meant to bend.
It's supposed to
Bent to
curve.
kind of have an arch forward. It's like your lower
Arch
back is supposed to be
forward.
arching inwards. The neck should have a similar arch. You just don't see it.
Right.
But you can see that, okay, if I have very bad posture when your head is shifted forward, you know that it's screwed up. Okay, so what can happen is the common symptoms in neck problem. You start about migraines. So you also have something called cervicogenic headache. When you have degenerative changes in your neck, okay, you start giving you migraine-like symptoms, but it's caused from the neck, and that's why it's called cervicogenic. That's the origin of it. So they're very similar to migraines in the frequencies and intensities that's going on. So then you can have these referred tension headaches and all that. So neck problem is linked to so many different things. You can
does.
have your headaches, you can have pain and weakness down the arm.
Exactly.
Like your husband
Exactly.
Kevin,
Yep.
where he came to see me because of that.
Yep,
And
that's right.
he was, what is it, 46?
He's 46 and he left it for too long because I've been, on his case. He doesn't really exercise, like we're opposites. He doesn't like working out. So, but one day he basically just woke up and he was in so much pain.
He couldn't move.
He just couldn't move. He couldn't, like even in the car to go see you, like that little movement, a little bump, it would be excruciating pain. It was excruciating
I
pain for
actually
him.
have his first before and after x-rays
Oh,
over
yeah, you
here.
should check this out, Andrew.
And you can see these look like massive cat claws sticking out there, and these are the bone spurs that start having because of the unfair stress. So the stress and strain, you can have a look at it here. So the stress and strain is like if you do, go to the
know.
gym or do manual labor and you don't wear gloves, you get these calluses in your hand. So you have this extra stress and strain happening in your neck, and that's why you start having these bone spurs.
Right.
Because
His neck is
Oh yeah,
basically
he
like
shifted
that.
almost 5 centimeters forward.
Yeah.
And he had 40% loss of grip strength in his right hand because of this. But like the treatment for him, we don't just adjust him. Just adjustment alone is not going to fix this problem. So each session takes about 35, 40 minutes with him.
Yeah.
We do a lot of traction. We do some rehab work to retrain his posture and things like that. And he does a lot of stuff at home also.
Yep.
Being mindful of his posture, paying attention. So, the adjustment alone is not going to be the holy grail. It's just going to resolve that. It takes a lot more work and effort to resolve a neck problem like this.
And what causes something like that where your whole neck just goes forward? Like,
I would say
years
mostly bad
of-
habits.
bad
smartphones.
habits.
I mean, I cringe when I see babies, well, not babies, toddlers
Yes.
in restaurants with tablets. So they want the child or toddler to shut up, and then they put a tablet, and they're like this, and they're like this for 2 hours.
Yeah, it's true.
yeah.
It is crazy in my
Yes,
opinion.
young parents, please don't do that
Yeah.
to your poor children.
Yeah, so get a stand or put it on the table or something at least. Be a bit more mindful. The funny thing, I was in U.S. Visiting another chiropractor, and I saw a book written in 1932. 1917, they already knew the school table should have been angled 15 to 30 degrees.
Oh, wow.
And then we went on to being flat.
Yes.
So,
Yeah.
we should have these angle tilted tables like laptops. I mean, the latest research from 2020 is saying that when you have a tablet or a computer monitor, your eye level should probably be in the middle of the screen. It used to
Right.
be like, the screen should be 15 degrees down. No, lift it up, and if you have these big screens, get at least maybe the top third of the screen to be at your eye level. And magnify. For my age now, I realized that this magnification thing, instead of pushing my head forward, I can just magnify the web browser and Word documents. and Excel
exactly.
spreadsheets.
Instead of having to
Yes.
crane your neck.
Yeah.
It's a
So those are the
mindset.
few simple things that people can do on their own.
Yes.
Yeah, but maybe you could talk us through a little bit of the system because I've seen his setup.
Yes.
When I went with Kevin, and it's very unique. It's not a normal chiropractic setup. I think it's something that's just unique to your
Yes.
school of
So
thought.
I was working with spinal correcting. Okay, when I graduated first back in 1997, so I was doing this normal, coming for an adjustment, I adjust you, do some muscle work and all that. And I did that for a decade. And then I was hearing, you can actually change the structure of the neck. And I was like, whoa, nobody ever mentioned that to my school. Okay, and most schools don't even talk about it. It was something that started happening in the US, so I got exposed to that. They're like, oh, you can do this, this, and this, and you can change the structure of the spine. I'm like, whoa, this is something completely different.
Yeah.
Because I've done these patients, you adjust them, you treat them, and then they come in, and the frequency they have to come in for the same problem becomes shorter and shorter, the interval. So then I realized, okay, you can actually change the structure and bring it back to normal, because all the anatomy, medical anatomy books say, okay, normal spine is curved. So there is no disagreement what is normal or not. But because they don't know how to fix it, they say, oh, you can still be symptom-free with it. Yes, you can, but you're going to have degenerative changes over time. Like Kevin had in his x-rays, this bone spurs growing. So that's what we start seeing. Okay. So being able to do that was something revolutionary. So, first I was exposed to, okay, you just put a block there. But the frequency or the relative number of clients that got better was kind of low. And so I tried a few different methods, and then I combined something in the past 10 years myself, and I could not only shorten the duration, how quickly they could actually get better, but a far more higher consistency rate. So probably over 90% of cases I can help them. Most cases I can correct in 3 months. All right. Like the case that I showed you from Middle East, I did that in 8 days because she flies into me, but she spends multiple hours in the clinic. So I treat them 3 to 5 times in a day. Okay.
Wow.
But I spoke to her, that was back in 2016. I spoke to her 2 years ago, and she's been great the whole time. No need for new more treatment. She just needs to be mindful of her posture. So changing this structure, you can't do it by manipulation alone. There's a couple of research papers to show that, that's not going to happen. I'm a little bit cheesed off with the chiropractors because if you've been doing something for multiple years, you would know that, hey, this is not delivering the results that I'm claiming that it should be.
Yeah, no, and I remember you said that your ethos is not to have the patient come in over and over again. It's just to fix the root cause and then get them on their merry way. I think I'm going to be your next patient.
Me too. I need to ask you one thing though. Does pain travel? Because I found that after I sorted my shoulder, I started getting a lot of pain in my lower back.
What can happen if you think of the body like a kinetic chain? So let's say you sprain your ankle, you start limping. And that limping puts a strain in your lower back. So over time, you start having some issues. Same thing, let's say I can't use my shoulder now, I start compensating. I start leaning my body, doing things. I mean, the human body is a master at compensating things, okay? Yes. So because of that, you can then get a next stress point. So I don't know, I wouldn't say that it travels, but it shifts the stress to somewhere else. So if I can't, lift my arm up like this, I keep doing this, I start tilting my back. So we start compensating over time.
Right.
Makes sense.
I get it. What about having no ab muscles? Because I had a transplant surgery in 2002.
Yes.
So I have no stomach muscles. No matter how I try to even do a sit-up, a little bit of a crunch, I can't seem to do that.
Did they cut off the nerves?
The incision is like a Mercedes-Benz sign.
Okay.
So I would think most likely the nerves have been cut.
Once you cut off stomach muscle is actually quite interesting. They are not a flexion to crunch up. The reason why we actually have this, six-pack or something is the tendency to allow us to be shear forcing so we can turn. If you had a straight muscle bed like a bicep like this, it doesn't shift. That's why we have this tendency in between allows us to give
for
the
the
torsion
six-pack.
Yes. So that's the benefit. Because otherwise, if you tighten it up, you'll be like stiff like a robot.
Right.
Okay. So what happens is it's actually more of an anti-extension muscle. So gravity takes care of this part. Okay. It's more to prevent for anti-extension, like in javelin or things like that. That's what we're doing. But what happens is when you cut off a muscle, the signal conduction gets worse. So it's harder for you to activate the signals. Let's say you had this and you cut it off and then they don't match up and the nerves don't match up. It's hard for you. It's kind of have a nerve damage there. And that's probably not the main priority when they did the surgery to get the blood vessels and the big nerves to be there. Right. So that can be harder. But there is a condition, medical condition, when people are born without stomach muscles. They call it the prune belly syndrome. Oh. They actually it's a genetic thing. It's very rare. But the reason why I know about it because these are the only kind of people that have kind of like a massive arch from your lower back all the way to your neck.
So do they have back pains?
They definitely have core issues. Yeah. Think of like the lower back, the core muscles, they're like stabilizing the phone mast or something like a sailing mast. Then they tighten up to stiffen up the spine.
Yeah.
Because without those muscles, the spine would crumble at a load of 9 kilos.
So I've probably been overcompensating by using my back quite a lot.
Yes, and try to get, actually for chronic back problem, try to get the side muscles working. So if you had this operation done over here, they probably left the side muscles intact. So you can have a pretty well done over there. So side planks, things like that. And for stomach muscles, sit-ups actually bad for us.
Okay.
Because we're crunching the spine, and that's how we actually studied disc herniation, slip disc in laboratories. They put them in a mini crunch machine, about 100,000 of them. The gel will pop out, and you have back pain. So we shouldn't be doing
The what will pop up?
the gel, the slip disc.
Yeah.
So
Oh,
if
the
the gel
gel,
is
the
this,
gel.
that will then
Okay.
push out and irritate the nerves.
Oh,
So that's a
That's a
classic what they
no-no.
call slip disc.
I
It's the gel that
see.
slipped out of the disc.
We here at AndWon Should Know always have a section on debunking myths. And I think
Okay.
there are a lot of myths around chiropractic care
Yes.
that deemed to be asked. One of
Yes.
which is, I think a lot of people think that chiropractors are quack doctors and they aren't real doctors. Can you speak a little bit to that?
Okay. The reason why it's a good question. I must say that there are some few chiropractors a little bit out there. Okay, I've seen them and I heard about them. I read them on websites. You know, when they go into crystal healing and all that nonsense, that's a bit
The
far out
woo-woo
there.
stuff.
Yeah, there are different personalities, and maybe that was more accepted in the profession earlier on, but very rigorously science-based these days. The term doctor actually comes from the Latin word docere, which means to teach. So the first doctors were actually religious leaders. I think it's about 12th century or something like that. And they were actually had the license from the church to be, teach theology.
Oh,
Okay, and I think is it 1312 or something like the Paris University actually got the permission from the Pope to issue doctorate degrees. So doctor is actually more of an academic term.
ah,
So you have a doctor of jurists, those are lawyers. Okay, you have doctor of engineering in Germany. Okay, so you have all these different doctors, like PhDs, they're philosophy doctors. But now when people say they have this associate doctor means a medical doctor. Yeah, I'm not a medical doctor. I just have a degree of doctor of chiropractic. So it basically is an academic degree. If you have the master's and you have doctorate, and then you got the PhDs.
and the other myth that we've also heard is that chiropractic care is something where, you're set up for life. I think a lot of people, just because of inherently how it's been set up, in particular in Singapore, where you're entering chiropractic care and then you have to do it for like 20, 30
Yeah,
years.
that's
Is
something I
that-
kind of disagree with. That's not. It's a good way to make money.
Yeah.
Yes. When you start having that, you need to come in every week, or that becomes, it will have certain benefits. And I have some friends who played National Hockey League in US, and they get tackled 50 times. There's a team chiropractor in every National Hockey League, an American football team. They adjusted, but those guys get tackled probably 50 times a week. All right.
Oh my
The last
God.
time I was
Regular
tackled
person.
was, when the kids were small.
Yeah.
So I don't need to be adjusted multiple times per week.
Right.
Because of that. And I think if you can fix the structure of the spine, like this 86-year-old lady that I had, she has no degeneration. So basically, why would she, if she has good optimal alignment in her spine, why would she need to go get adjusted? Yes, if you have a stiff joint and all that, to loosen it up. But I don't think you need to religious to go there all the time.
Right.
I think if you have a good structure and posture, you do yoga. Yoga is great for achieving normal flexibility. I'm not talking about these hyper-flexible people.
Right.
I think they're pushing it too far.
Yeah.
I think being physically active, stretching, foam rolling, having good tissue quality. Yes, if you have some nagging issues every now and then, go for get an adjustment. But having to do that all the time, unless your job is something really bad, like dental surgeons, that is
Right.
probably the worst profession you can have for neck and shoulder problems. So I did a presentation with them 2009 talking about it, and 50% of the people that actually retire before the age of 50 do that because of neck and shoulder pain and arm pain.
Wow.
Oh
Dentist.
my goodness.
We have to appreciate our dentists
Yes, it's
more,
true.
really.
Yes.
Yeah.
So they can't. I mean,
That's
they can't
minute
put your
space,
mouth
yeah.
in front of you. I mean, that's the nature of their job. That they can't change the ergonomics.
What about medicinal patches? Every time we get pains, our mothers go, here, slap on a koyo. Yeah, exactly.
I guess that's good for local blood circulation and symptom relief, and that's fine. Even I, when I screw up my back or if I lift and I scrunch, I will use the ointments. It helps me to mask the symptoms and all that. But, and if you had a muscle strain or you woke up with a bad neck or something, you couldn't get a result, get a heat pack or a hot pack or things like that. That will help to relax the muscles.
Okay.
That's fine. But if you're doing that all the time as a coping mechanism, then you probably have some underlying issue going on, and then get it checked out to resolve it.
It's not gonna cure it, right?
No, it's all
That's a myth.
addressing the symptoms. Yes.
Okay, and a final myth.
Yeah.
I hear that chiropractic care is only for people within like a certain age group, 30s, 40s, maybe up to their 50s, and then that's about it. But now we're hearing
yes.
that
Well,
it's not.
I like I said, I had teenagers that I helped, and my sister got help when she was 8, 9 years old. I know that in US there's some people that specialize in pediatric chiropractic. They're basically born babies and all. I never ventured into that area. Okay, but it's available. It's like a specialty.
Okay.
Okay, and if I ever were to have a child that I would concern to have an issue, that I bring my own children, I would make sure that they actually had that specialty education there. I wouldn't just go to any chiropractor. Oh, can you adjust my child? I mean, right. I did not adjust my kids when they were young that age.
Yep.
It's just not doing that. And I have had people that are senior citizens, like this 86-year-old lady. I didn't need to adjust her.
Right.
But I could do some other muscle work with her. So some people, you have to adjust your, treatment to the client. I have some clients that actually come and say, hey, Will, you look too big. I'm just scared to be adjusted by you. I'm not going to use all my force every time I can modulate it, all right? But like this advice, if you have a client or a senior citizen or somebody, or even if they have osteopenia, osteoporosis, you got to be very gentle. Maybe you start doing some mobilization work, some other stuff with them. Okay, so you don't need to just limit yourself in your prime years to be adjusted.
Right.
Okay, and I think if chiropractors only, I think spinal manipulation adjustment is one tool in your toolbox.
Yep.
So if you go to get a carpenter and he only has a hammer, you're like, maybe not. But you need a saw, you need some other things, screwdrivers and other. So basically,
Preferably not a saw.
I'm talking about the carpenters Yes. So you need to be able to do something else than just adjust every time.
Yep.
So like for me, I do traction on my patients. I do adjustments. I do rehab exercises and postural rehab exercise for them. So you need to have the whole repertoire to address the issue.
Yeah, that's very true. Well, thank you so much, Dr. Will, for that. I think that really helped us.
Absolutely. Really informative.
I hope so. It was a pleasure to be here.
Yes.
And to share my slightly different take on what I do on things.
Thank you so much. That was
Thank you
very,
for
very
your
helpful.
time.
Yes.
We hope you enjoyed that episode with Dr. Will Kala. Dr. Neck Pain, literally. If you have any other pains, pain in the ass husbands, pain in the ass boyfriends, that we can't solve. But for neck pains and any sort of body pains, we had so much fun with Dr. Will Kala. We hope you did too, and especially that it was very informative to address whatever you're feeling these days, especially if in your peri-menopausal years. We hope we helped.
Yes, make sure you get checked out anytime you get, you have any pain. Make sure you're in the prevention mode as opposed to waiting too long to actually take care of yourself.
Yeah.
So thank you so much. If you have any questions, please feel free to leave us comments below. And we look forward to seeing you in the next episode.